So you can say you've been having some shoulder problems?
Last night when I was at a board review, I was in class all day and I had a board review, and pretty much right when the board review started, I kind of had like an achy, like heavy pain like inside my shoulder, and it was like deep and kind of just dull. And then I got home, and like it was 10 o'clock, it was a late board review, and I got home and laid down, and almost like that, right when I started laying down and like trying to fall asleep, it got worse and worse and worse, and then it kept like fluctuating pain, like it would get really bad and then go back down to not so bad, but it still was always pain with it.
Okay, so you said that was kind of diffuse and achy. Was it ever sharp or have a different character?
When I got really bad, it did get sharp. Like it was achy and hard to like locate, but then when I got the sharp pain, like up to like a 9, like really bad,
Okay.
it was sharp, yeah.
Okay. During that time period, did you have pain the entire time, or was there a point in time where it completely went away?
No, it was always there. It was like it was at a 6 constantly, and then it would go up to like a 9, that sharp pain, and then it would go back to 6 and a 9.
Okay. Is there any position that seemed to make it better, especially when you were sleeping? Or?
No, that was the worst part. I would try to like distract and flex it up and stretch it, and I mean, position like not laying on it, and it was always there. Nothing helped it.
Did anything aggravate it? Any certain position aggravate it?
No, it was always like constantly the same.
Okay. Did you have anything that might have brought this on? Like, did you do anything with that shoulder?
Not anything out of normal that I would do. It was all the same, and no like trauma that I can think of.
Okay. Have you ever had this in the past?
No.
Okay. Right now, as you're sitting there, do you have any pain?
It's just a little bit like doesn't feel right, but it's not painful.
Okay. Can you take your fingers and point to it, or is it like hard to locate?
It's like kind of in my shoulder, like in here.
Okay. And do you notice any neck discomfort at all?
No.
Okay. Does the neck position seem to change your shoulder symptoms at all?
Not too bad.
Okay. Do you have any symptoms into the hand or fingers?
No.
Okay. Do you notice any problems with like heart palpitations or?
Nothing that I can think of.
Okay. Do you have any jaw pain or anything like that on that side? Okay. You notice any fatigue?
Not out of the ordinary.
Okay. Symptoms going upstairs, downstairs, or?
I mean, just going up the stairs at school, maybe fatigue, but I think that's kind of normal.
Okay, so nothing abnormal. Do you have family history of heart problems?
Yeah, my grandpa has had a pacemaker, and he's had an MI.
Okay. And what age did he have the heart attack?
It was a while ago. It was probably when he was like close to 60.
Any other family history of high blood pressure or irregular heartbeats or?
Nope.
That you're aware of? Okay. Do you have any digestive complaints? Any problems with eating, digesting?
Nope, not that I can think of.
Heartburn? Constipation, diarrhea?
Nope.
Bloating? Anything like that?
Nope.
Okay. Anything else that's recently changed for you in terms of your history, health history?
No, not really. I mean, just with like finals and everything, maybe just a little bit more stress, but that was kind of normal with midterms and finals.
Okay. Well, let's do a little bit of exam. And first, I want to make sure that, because it's left side, and as you know, sometimes that can be heart related. So, well, first I'm going to start with checking your pulse.
Okay.
So if you can just kind of relax your hands. Do you notice any anxiety? Because I'm noticing like that your pulse is really fast and.
Like I do get a little anxious just even like talking about stuff like this. Normal, like even when you go to the doctor's office, I have a little bit of like higher, just normal anxious person.
Let me, if I can look at your nails. You do have them painted.
Yeah.
Do you notice any changes in what your nails look like?
No.
This one, there's some chippings, but then that's a good thing for me, so I can kind of look there. Okay. Have you had any shortness of breath?
Not that I've noticed.
Okay. What I'm going to do is first listen to your lung sounds, because sometimes the lung can refer to the shoulder. And have you had any colds or anything like that?
Nope.
So what I'm going to have you do for this, I'm going to first do it just through close, and then if I notice any abnormal sounds or I'm having a difficult time hearing, then I'll actually go skin on skin, okay?
Okay.
If you can cross your arms in front of you and just bend your head down, and then I just want you to take deeper than normal breaths every time that I put this stethoscope on you.
Okay.
And go ahead. You can relax your arms. And then I'm going to place this part right there.
Okay.
And again, take deeper than normal breaths. And one more time. Good, those sound really clear. Now I'm going to listen to your heart. Okay, so I'm just going to start over here and just breathe normally. Okay, and go down just a little bit more. Okay, if you can pull your breast up and away on that side, and I'm just gonna go right here with it. Now, you don't have any irregular heartbeat, so that sounds really good. No murmurs. I do notice that is extremely fast, consistent with your pulse. So have you ever been told you've had tachycardia?
Mm-mm.
Okay, because that's often sometimes will correlate with some anxiety and things like that. I'm going to have you, since we have the stethoscope out, I'm going to have you on your back, and just, there's a lot of things in the digestive system that can refer, so I'm just going to listen there, and then we'll do a shoulder exam.
Okay.
So if you can expose your abdomen. Okay, and again, just breathe normally. Might be a little cold.
Okay.
Okay, those sounds are really good. I'm just gonna have you take a deep breath in here, and then blow it out. Good. And just breathe normally. Do you with the abdomen, have you ever had any problems with your spleen or like that? Have you ever been told you have anemia? Or, those are pretty good. I'm just going to do some gentle, be patient in through here. Any discomfort with this?
No.
Okay. I'm going to help you to sit up and then have you swing around. And then we're just going to do some basic range of motion. So I'm going to have you with your thumb up, and I'm just going to have you go like this for me. And then go up as far as you can. Got any discomfort with that?
A little bit, not much though.
Okay, where's the discomfort?
It's just in that same area.
Okay, let's go ahead and do the other side. Okay, excellent. And with the same arm, I'm going to have you with your thumb up go out so you can go to your ear.
Okay.
Good. And come up a little bit more if you can. Excellent. And then back down. Any problems with that one?
Nope.
Okay, and then this side.
I start to feel a little pain right there.
Okay, and then just relax here, and then if I bring it up,
Yeah.
any discomfort?
Not too bad.
Okay, and then what I'm going to do is we're going to do Apley's. So this is, if you can stand, and then what you're going to do is you'll kind of mimic me here.
Okay.
Put one hand like this, and go ahead and do that. Excellent. And then the other way. Good. And then back down. And then if you can do this for me.
Okay.
And the other side. Any discomfort with that?
Yeah.
Okay. If you can sit facing this way, and we'll do a few muscle tests here. And have you hold. Okay. And then do the same thing on the other side and hold. And then we're going to come up like this, and I'm going to pull back, resist against me. Good. And then this side and resist. Good. And then we're going to do the posterior deltoid. I'm going to push down like this way.
Okay.
And resist against me. And try again. Okay, we're going to do the other side.
Yep.
And hold. Okay, and both sides are weak. We're going to now test the infraspinatus. I'm going to have you push your elbow in towards me.
Okay.
And then push out. Excellent. And let's do the other side. Push in with your elbow towards your body. Bring your arm in a little bit more. There we go. Now push out. Okay, that one's weak. We're going to do the lift off test. So you're going to bring your arm like this and just rest it in your low back.
Okay.
Start with that one. And then push out against me. And then resist. Excellent. And then do the other side for me. And then push out. And then resist. And then what we're going to do is have you put this hand on this shoulder. And resist against me. Okay, now just relax. Good. Now you're going to just relax. We're going to do this and put your arms like this and have you resist. Good. And then relax. And then arm like this and then resist. Lock out your elbow. Good. Excellent. And then if you can relax on your side facing that way. And then completely go up on your shoulders.
Okay.
And then I'm going to have you curl this up just a bit.
Mm-hmm.
Now I'm going to have you tuck your shoulder down towards your feet.
Okay.
I'm going to bring the arm out like this. And this is going to be kind of odd, and this will be actually extremely painful. So right there, really painful. Does that seem to reproduce your pain?
Yes.
Okay. What I'm going to do, you're not going to like this, but this is called a posterior capsule release.
Okay.
And this is actually going to be the main treatment modality that will help you. What you're going to do is you're going to put your hand here, keep it in there. Pain is actually good for this technique. I'm going to put one hand here and one hand here. I'm going to roll you over. There'll be pain,
Okay.
and then there'll be no pain as I bring it off. Remember, pain is good for this. Hang in there. We're almost done. And just keep it there. This will help to elongate the capsule because you're starting to get a frozen shoulder.
Okay.
And then relax. Good. And completely relax. And then another thing that would be good for you, if you can stand up. And I'd like you to lay on this foam roll. Now I want you to bring your arms out like a goalpost, but just short of a goalpost where it's a little less than 90. Okay, are you relaxed? Yeah, okay, so that's your relaxed position. Yeah, because that means that there's capsular involvement in through here, especially when we have this type of rotation. So what you're going to want to do is you're going to want to lay. Do you have a foam roll? You're going to lay on a foam roll, and you can actually put some heat and drape it across you, and then you can even use at first you might just want to use the heat and keep here for about 10 to 15 minutes, but this will start to lengthen over time. And you'll notice our goal is for your hand to touch the ground. But then if you're able to tolerate it, after a few days of doing this, you can then put a can of beans or something like that in your hand to add a little bit of weight, and that'll also be beneficial to you. If you can roll on your side by just kind of plopping, it'll be kind of non-elegant. Yeah, there you go. It'll be easy on your shoulders, and then come on up.